This episode of the Barry Chronicles is proudly brought to you by Bariatric Support Australia.
Hi everyone, I'm Tash.
And I'm Damo.
And we are so excited to bring you this week's episode of The Barry Chronicles. Damo, I am really excited about today's guest.
I know. Last time it was fantastic.
It was, and we love our friends of The Barry Chronicles, and we consider Nurse Jarryd to be one of them. So thank you so much for being with us today, Jarryd. We are so excited to have a chat.
Yes. Hi, so we're here with the amazing Jarryd. Jarryd, thank you so much for joining us again on the Barry Chronicles.
Very happy to be here. Always love a chat. It's hard to shut me up sometimes. So very happy to be here and talk to you guys again.
Yeah, we were really looking forward to this one because, you know, we've all been there where we've been trying to either advocate for ourselves or for someone that we care about. Sometimes it feels like in the public system, as I love our public hospitals and our nurses and doctors and all of that.
Very grateful and appreciative.
But there seems sometimes to be unspoken rules of how we navigate, you know, if we need some extra help or if we even want to get the right referrals to the right people. And so we're wondering if, you know, maybe we could have a bit of a chat about that today with you.
Yeah, absolutely. Public health is a real passion of mine, and particularly public bariatric surgery and obesity treatment, because it just doesn't happen in enough places. It really is such a rare thing in Australia, and it really shouldn't be. So the more we can bring up the conversation and help people navigate these hospital systems, and that's a really big part of what nurses do, hopefully we can build that build that advocacy, and more treatment centres and public services will become available for people.
Yes,
yeah, we've had
the dream.
We had someone last week post that after 10 years, she finally got the call that they would see her in the obesity clinic. Well, she'd already gone on to have her weight loss surgery, you know, I think it was like 1 or 2 years ago.
Yeah.
And she'd just forgotten that she was still on the list.
Yeah.
10 years. Like,
yeah. It's incredible. And often that wait time is, a lot of people think once you're referred for surgery that A, the referral's automatically accepted, and B, that means that you're on the wait list for surgery. And a lot of times people don't realise that that's often when the referral comes in, it's a referral for an outpatient appointment. So it's a completely separate wait list to a surgery wait list. And so not having the awareness, and it's not really advertised, sort of how these systems run, to know where you're at in a process. And many times, you know, and things, for one of it, things slip through the cracks sometimes. And so I'm a big advocate for really encouraging my patients to, if you think you've needed to have an appointment and you haven't had one, call me. Call me if you feel like you want to touch base again, or, you know, just call me, because things happen, and, you know, for best laid plans, it's difficult navigating the system. So it's really important to be able to advocate for yourself, which a lot of the times patients seeking obesity treatment have had a lot of trauma in seeking healthcare treatment. So it makes it really hard, and there's not that agency there to be able to do that. So yeah, it's a really complex and emotive process navigating the public health systems.
Something that surprises me, even still, I guess, that we can often feel like we don't have the right to even ask because it is through the public system. And there are certainly some people that would agree with that and say, no, you don't have the right to ask where you are in the queue or what's going on. But do you think that may cause other, the anxiety? And, you know, I think there's got to be a way that people can ask those questions without feeling like they're being rude or...
Yeah.
So what would you say to somebody, our listeners, who are at the beginning of the process and they're in a place where they will be accessing public health to be able to move forward with some type of bariatric procedure?
Yeah. So the first thing I would do, depending on your location, so we're very lucky in Victoria that we've got a number of public services that offer obesity surgery. Different states, different things. I know Perth has what we consider a high volume public service. Brisbane has a few, less so in New South Wales, unfortunately. Adelaide also have some. And I'm not actually aware of whether the Northern Territory offers anything. I know I've had a few patients come down to us at Austin Health to have their publicly funded surgery with complex needs and things. So I'd first of all investigate the service that you're hoping to be referred to. And most of the services in Victoria don't actually have catchment areas. So you could be referred to a different service that might be a little bit further away, but might have more of the services that you might need. So, for example, some hospitals have specialist heart services, and so that might be something that you could align to collaborate in that care. A lot of the public services have referral requirements, and so there's something called GP referral guidelines, which are often published on the outward-facing websites of hospitals, and they outline things that you might need to have some blood tests prior to the referral being sent through. There might be screening tools for sleep apnea or things like that, and so knowing what you might need to do, or what your GP might need to do, and the GP clinics are often under-resourced as well, and they're under a lot of pressure, and you might only get 5 minutes in with your GP to activate a referral or get that sent through. So knowing what you might need to include with that referral is really helpful to help sort of move things along. And there's also contact numbers on most of at least in Victoria, on most of the websites. So you can often just go onto the hospital website and search either bariatric surgery, metabolic surgery, or weight loss surgery, depending on the terminology the service uses. And there's contact numbers. So I very much encourage people to call if they've got any questions about how to get referred to our service, and a lot of our documents are available online to help navigate that. So that's a really good place to start as well, because those services are available and should be available across all public services, because there are roles and services in place in hospitals to help patients navigate the system, which a lot of is not really publicly known. So that's also a really good place to start. And there's for public services, we're often governed by the National Framework for Public Bariatric Surgery. So there was a task force set up back in 2018, 2019, and we published just as COVID hit, unfortunately. So it wasn't as widely publicised as it should have been. But that framework exists to guide services on what they should be providing and how they should be providing it, and criteria for expedited care as well, because there's some circumstances where there is what we call for want of a better term, a bariatric emergency, or there is an emergent need to have expedited metabolic bariatric surgery. And so those criteria are on there as well. So if you're aware of that, and that's freely available on the government website as well, you can just type in National Bariatric Surgery Framework and it'll come up. And so you might find that, or some of the listeners might find that I have X or I have Y or I have Z, and that might mean that I warrant that. So including some of that information in referral can actually also help quicken the process too.
That's excellent. I didn't realize that existed. So if I didn't realize and I haven't heard, and I'm sure Damo's the same, then I'm sure that will be very, very helpful to our listeners. I think too, even if we take a step back, when we go to the GP, I think if we're intending to ask for a referral, it's and I understand that sometimes it can be difficult to ask for a longer appointment. Maybe there might be financial constraints or whatever, but I think that it is a good idea. And would you agree, Jarryd, to give your GP maybe a little bit longer so that you can actually discuss these things?
Yes, yeah. And sometimes it can be challenging to discuss these things. And it may be something that you need to bring a history to and some context to, so you can run through, these are all the things that I've historically done, and I know, and the research that I've done, I've found that this is not going to be something that's sustainable for me long term, and I want to seek to have metabolic bariatric surgery for this reason. So you may not always need that time, but allowing a little bit of extra time can be sometimes helpful. So if there is further questions, or if you need to fill out a questionnaire, some hospitals require a questionnaire, or to do a sleep apnea screening, you've got that time available, so you don't feel like you're being rushed out the door and a quick one-liner gets sent off to a hospital that may not actually, get through the system. So
Yep, that's excellent. So once that referral process begins, what at Austin Health, for example, what happens? So the referral arrives.
Yep. So the referral gets registered through an electronic management system. And so there is a record in your file to say that a referral's been received. Then there's a process where clinicians triage those referrals. So they assess the information in the referral and then allocate a urgency category. So there's a few different categories in terms of time frames that a referral needs to be processed or an appointment needs to be provided. Sometimes if a referral comes in and there isn't enough information to make that clinical judgment, a request goes back to the referring doctor for that further information.
Okay. So that's why the importance of as much information in that referral as possible.
Yeah. And sometimes so a referral can go on hold, and if then that further information isn't then received by the hospital, referrals can be then automatically discharged because there's not enough information. And so that's the bit that I really encourage when talking to people around being referred for these, and this is for any surgery or any treatment that is required, that to call up and double check that a referral is active, that you've got what's called an active episode, that a referral has been accepted, because at that point then you know that it's in the system, so to speak. So sometimes if it's, automatically declined because there's not enough information or for whatever reason, it will show up in your file to say that the referral was declined. So I always encourage people to follow up and double check, because things happen and it doesn't always get through. So as much as we want to hope that the system is perfect, always follow up is kind of my model.
So there are a few spots even in that initial time frame that things could just get lost or go wrong. Or
and it doesn't and that's even before it might even get to the team that needs to see that. I know sometimes you might have a GP clinic that might fax a referral and there's something wrong with the fax machine at that time, or it's being rebooted or something like that. Often we're still relying on, can't believe it, fax, to things. So as much as, and often sometimes you can ask for a copy of your referral. So I've been to my own GP before and said, I'd like to get a referral for XYZ and get a printed copy of the referral. So then if there is some additional information or if something gets lost, then you've still got a copy of that you can then follow up as well.
That's excellent.
And you're allowed to ask for that. You're allowed to ask a copy of your medical records.
Oh, that's great. Excellent. Yeah, because my GP, he automatically emails everything to his patients.
That's great.
So it's like, yes, I've got that.
Yeah. No, that's great. Yeah.
That's awesome. So once that process happens and the clinicians are able to get eyes on it and the categorization happens, all of that's obviously based on a particular medical criteria.
Urgency needs. So those expedited criteria that's in the national framework, so those would be assessed and say, okay, we need, you need to come direct to clinic. So we have at Austin Health, we've got 2 streams, so to speak, and a number of other public services offer this as well. Not all, but most do, where there is a direct to clinic pathway where there is an urgent need for a medical assessment. And that's usually for those category 1, those urgent priority categorizations. And that means that you should be seen in clinic within 30 days.
Right.
So it should be within that month. And sometimes patients will go to have that assessment by the doctor and determine, yep, you're actually stable enough that we could go through our standard pathway. And the standard pathway is a comprehensive education and information program. So we have an online seminar where we talk around obesity, do a lot of myth busting, talk about different options to treat obesity. So be that medications or surgery, to offer sort of the whole suite of treatment options that are available, and then talk around what we do as part of the workup for surgery and how to get to surgery and some of the transition points or some of the hurdles that people might come across and how to help navigate those.
Yep.
So that's that initial seminar. And then we have a series of self-directed learning modules to help build some of the skills and knowledge to be able to help navigate the after surgery phase.
That's brilliant.
Yeah. So that's sort of the, so if patients need that urgent assessment, they have that, but then they can often come back to that education phase. So by the time you come to see the surgeons after that, what we call the pre-surgery program, you are more likely to be informed. You can help determine whether surgery is something that might align with you at this point in time. And it doesn't always for some people. Some people go, oh, maybe not at this point in time, but I'm glad I've got the information. So then I feel more informed down the track if I do want to seek treatment. So, and that whole informed consent and informed healthcare is there is such a need for that. And we really try and do as much as we can to help people have all the information they need to help make a decision about their body and their life and how they would like things to move forward. So
that's excellent. So can you tell us how long, because one of the most common questions that people ask on BSA is how long is the wait time in the public system? And I know that you cannot speak for all of the public system Australia-wide, cannot probably even speak for all of the public system in Victoria, but at Boston.
Yeah.
Category 1, 2, and 3. How long is the wait generally for obesity metabolic surgery?
Yeah. So generally what we're governed by, and we're transitioning to it's now going to be called the PSAP, but we have what's called the Elective Surgery Access Policy, and that is what all hospitals are governed, public hospitals are governed by. And so depending on the waitlist categorisation, Category 1 surgery needs to occur within 30 days. So, and that might be the scenario if you have, for example, a slipped gastric band needs to come out, you're getting severe reflux, there is a whole gamut of problems that come with that and risks that come with that. And so often that's where that categorisation fits. And then expedited surgery and the general metabolic bariatric surgery that is still urgent, in my opinion. Category 2 needs to be treated within 90 days and Category 3 needs to be treated within 365 days, so a year. That's what should be happening. It certainly doesn't happen. Particularly COVID has caused challenge for elective surgery waiting lists. And it's one of those things that particularly around election time we hear a lot about around, elective surgery waiting lists and things. So we view treatment starting from the start of the pre-surgery program. And at the moment we run that program every second month. So I've got another program next week where I've got another 50 patients coming through that pre-surgery program. And so we start treatment from that point. We start assessment. We start on referrals for further management to help support the journey to surgery at that point. So at the moment, that first outpatient appointment occurs at around about 2 months, and we've got capacity to sort of grow that pre-surgery program and that group a little bit longer because it's, a little bit bigger because it's an online platform. So we really have no limits on that. In terms of surgery, it depends on a couple of things. So we have 2 main campuses that we do our surgery. We have our surgery centre where we do majority of our surgery. It's our secondary campus at the Heidelberg Repatriation Hospital, about 1.5 kilometres away from the main campus. Most of our surgery occurs there because we do a lot of workup. We do a lot of assessment, and we've proven time after time after time the safety of that. Some people need more complex care or intensive care support after surgery, and then that's at the main campus. And so that then at the main campus, we're competing with emergency surgery lists. We have our transplant work and things like that. So there is sometimes the risk that if there is an emergency that comes through, surgery may be cancelled, but there is a really big push, and Austin's done a great job at ensuring that elective surgery is prioritised as well, because it's really something that is needed, and it helps keep people out of emergency departments. So there's a lot of work being done in that regard. So we really don't find that. I actually can't remember the last time someone was cancelled on the day of surgery because of a lack of bed access or emergency. And that's a long way of saying in terms. Yeah, it is. It's great. It's great. It used to be a really common occurrence. Pre-COVID, but there has been a real shift and a real prioritisation from the government, but also Austin Health in ensuring that elective surgery is occurring how it should be occurring. So we've been really lucky in that regard. And that's a long way getting back to the actual time of the wait list. It's really variable depending on a number of things. So some people can be waitlisted as a Category 3, so ideally treated within 1 year, and have their surgery in 45 days. If we're able to get the pre-admission appointment. So everyone has a pre-admission appointment to do a medical assessment, do some further education, sees the anaesthetic team to get assessment and clearance for surgery and help with planning, and then also our dietitian team to do some of the pre-surgery education as well. So we can publicly share the news now that earlier last week, we got news that a business case that we'd submitted came through. So we now have an additional huge amount for our dietitian team.
Oh,
We
that's
also have
wonderful.
an allied health assistant and a psychologist, which is
my
really,
goodness.
really, really exciting. And it's all recurrent funding. So, it's really, to me, it's demonstrating that, the executive at Austin are really committing to the work that we do and value the work that we do.
Awesome.
Side note, but very excited about that. So there might be, all those appointments in the lead up, but some people, wait 6 months. It's very rare these days that people are waiting more than 12, 18 months for surgery, even if they need the complex work at the main campus. So unfortunately, there was a period of time where we're on hold to referrals. Which because of a backlog related to COVID. And we cleared that within 12 months. We offered a number of people surgery in that time. And so it's really, we're kind of meeting the elective surgery access policy guidelines in that way. So
Well done.
really,
amazing.
I'm really proud of what we do here. So we've got a great team that just continues to advocate, and any little improvement we can find, we'll make it. So.
Well, it makes me teary, the thought of the people that will be able to get help, that there'll be more, hopefully more dietitians, more on the ground, and even having a psychologist.
Yeah.
That's so exciting.
It's so exciting.
It's part of the journey that I have found personally was probably more important in the longer term. And I didn't realize just how vital it was going to be for my long-term health to access that particular type of service.
Yeah.
It's been completely life-changing. So I'm so excited that people that go through Austin Health are going to be able to access that kind of thing. That's amazing.
Yeah.
Well
and
done,
it's
guys.
often something that's only really afforded to those who access their surgery privately.
Yeah, that's right.
It's well established in the research that dietetic support, psychological support, it should be a mainstay and part of the multidisciplinary team, but it's not always afforded to those that seek help through the public health system. So, so I'm really excited that we've got that on board and ready to shout it from the rooftop. So hopefully, we'll get the recruitment underway soon. And
that's exciting.
Yeah, and we'll get them on the podcast at some point too.
Yes, absolutely love that. I'm so excited. That is such a fantastic development, just to see that mental health support coming online like that.
And it obviously shows that the metabolic surgery is working because before there's less people taking up emergency admissions to hospital and all that, if they're able to access their surgery.
That's right.
It's having that knock-on effect that other areas of the hospital aren't as busy dealing with things that
metabolic surgery does deal with.
Yeah. And there's that real health economics argument that it's actually something that is it ends up being cheaper to do than to not do. Providing that care and that service and that treatment will actually save a lot of money in other areas of healthcare. We have patients that are in our what's called the VRSS, the respiratory unit of complex respiratory conditions, and a number of patients have been able to be discharged from that service, saving thousands and thousands of dollars because we've been able to provide their metabolic bariatric surgery. And it's just such an exciting thing. And we love when people come into clinic and say, I got to throw out my CPAP mask, or I threw my dosette box in the bin because I just didn't need it anymore. And those, such an exciting thing. And it warms my heart. And I think when I got that notification that business case came through, I was on the way to my daughter's swimming and I was just bursting with excitement. And my poor parents, when they met us there, I was like, oh my God, guess what? And I think I made about 4 phone calls and no one was picking up. And I just wanted to share it with everyone that, it was such an exciting thing. I'm glad
Well
our patients
done.
can have access to that because they deserve it.
Yeah, they do.
And thank you and the team for advocating for it. It's just wonderful.
Yeah.
It is a life-changing part of. So I'm assuming then that the pre-surgery program at the Austin will be in flux. Like it will be a growing and changing space.
Yeah, absolutely. We have
going in.
Yep. We sat down a couple of weeks ago and did some planning, and it didn't look pretty at the time. There were fluorescent Post-it notes everywhere on the wall, but all of these things that we want to do and improve and how we want to change things and integrate different components. So it'll be a really exciting time ahead.
And isn't it really exciting? I mean, I do believe that there are wonderful people like yourself, like Dr. Craven, so many wonderful, passionate clinicians that are understanding just how life-changing, life-saving this surgery is, and that it's not just about weight loss anymore. It's really not. I mean, that's wonderful, but it's the health benefits and the life that comes with this surgery that I mean, it's completely changed. It's completely changed my life.
Yeah.
I'm no longer pre-diabetic. There's so many things. I don't have high blood pressure anymore. All of those things.
Yeah.
And I know that they're the reasons that you're also passionate about performing these surgeries and seeing that they're done in greater numbers.
Yes. Yeah. I was really excited when the bariatric surgery registry report came out, and we went from having, so they give us percentages of how much surgery is being done in the private sector, how much is being done in the public sector. And for so long, it sat at 4%. Now we're up to 5%.
Yeah.
It is just the tiniest little win, but there is so much growth. And I'm very lucky I have come into a service. There's a lot of privilege in what I've walked into, in that we have an engaged group of clinicians. We have an organisation that supports what we do, and that helps us grow and build on what we have. And a lot of colleagues in other health services don't. They have the passion in themselves and in the units that they work with, but don't necessarily have the executive support or the administrative support, but they continually strive. You know, and I'm thinking of a few of my colleagues in Adelaide. They continually strive just for little improvements along the way. And it's been so great that at our national conference from 2025, we're going to have a dedicated public bariatric surgery group of sessions. There's going to be more voices being elevated around the importance of public bariatric surgery, so we can help build the skills amongst our clinicians to be able to then help advocate and speak to our administrators and speak to the executives to be able to go, well, actually, it's not that expensive, and it's not this radical thing that you're going to need all these resources for. And this is all the things that it can do. And so, you know, even since earlier in the year, we had about two or three different public hospitals who don't have a public bariatric surgery service set up and said, oh, look, we want to start. We're just going to start small. We've got one surgeon. We've got a psychologist, which was amazing. We've got a dietitian, and we just want to start small and grow from there. How do we do it, and how do we help?
So Jarryd, if you, and I'm sure that there will be health professionals listening, if they are passionate about seeing public bariatrics in their particular area, what would you encourage them to do?
So I would encourage them, first of all, to join ANZMOS, be a member of ANZMOS if not already, the Australia and New Zealand, if I can say it properly, our Obesity Surgery Society. So join that. We have a number of conferences, and building those connections within that field can help build those skills and networks to be able to help navigate a lot of this. And a lot of the, particularly in public health, it's a really shared load, for want of a better term. You know, because we need to build this together. It's not about competing businesses.
That's right.
Or things that, you know, potentially exist in other areas, that we're all here to support each other. So, you know, we share a lot of our documents, a lot of our policies, a lot of our processes to kind of help other services, you know, prove to their groups. So I love my LinkedIn. So feel free to reach out to me on LinkedIn if there is any health professionals out there that are wanting to know where to start the conversation. As you mentioned, Alex Craven is a really big advocate as well. He's on LinkedIn too. So feel free to reach out. We're very happy to help build this. It's a real passion area for both of us. But building those networks, even in your state, and I know we've Anne's Moss Nurses Group, we're setting up state chapters. So then we can strengthen those connections amongst us, because the integrated health component of what we do is such a driving force, and nurses really have a great way of leading this and driving a lot of this. And there's so many of us in public health. So, reach out to someone. That's probably the best thing, is reach out to someone. As you know, I love to chat. So very happy to help network or introduce people to people that might be in their local areas to be able to, build those connections and grow.
Yeah.
Yep, it's just exciting, because on the other face of this, I every day get messaged by people who are just desperate.
Yeah.
And they want help. And they are the reason that Damo and I are so passionate about this. We were both privileged to have our surgery in the private sector, but I'm so very aware that there are people that are sitting at home listening to this who are hoping that maybe one day they might be able to live in a body that actually works for them, and that they can do just normal things. And they need help. And in order to get that help, we need wonderful people like you to be able to advocate and say, hey, we need these services.
Yeah.
So thank you.
Yeah. Yeah. And there's I really wish that we could get to the point where there is, and it's not really a well thought out idea, it just kind of came up. But do you remember when we were younger, and whether when on your way home from school and things, they used to have a little safety house? There was a little yellow sign, and, you'd be on a letterbox and, be a safety house. Yep. I really wish we had, while every health service should be a safe place to seek help, I wish we had, a list somewhere of GP clinics that are places that understand obesity, help treat obesity, are happy to help refer for treatment of obesity, so people can reach out to those, and we have at our Austin Obesity Conference earlier in the year, which seems like a lifetime ago now, there were so many great services that were there. And I really wish that we had a way of promoting these clinics as great places to be, because it takes a lot. I think I read a while ago, it takes on average 7 to 10 years to actually seek help in the first instance. And if you don't have a positive experience after you've spent 7 to 10 years building up the confidence to ask for help, and then be met with barrier after barrier after barrier. And I've had a situation last week which has affected me quite a lot, seeing the effects of weight stigma from someone who was seeking help, and that was in a vulnerable situation and things. And so, I really wish we had something available where we can go, hey, these are a list of great places you can reach out, and that it's going to be okay. I really, so maybe that's one for the ideas board.
It's something that I think we have a very small little lists on Bariatric Support Australia.
Oh yeah.
On our Facebook group, but it's something that we need some sort of national database.
Yeah. Mm-hmm.
Some sort of collaborative national database of all of the different allied health services and support. We need our physiotherapists, we need occupational therapists, we need
exercise physiologists,
we need everybody.
Yeah.
So I think,
so if you're in a bariatric clinic and supporting people, then reach out to us.
Reach out.
And we will add you to our lists and look at helping more people and making that more available.
But that's definitely something that needs development. It does.
Yeah.
It really does. It is so hard to make that initial appointment. If the GP appointment goes poorly, then I know from my personal experience, I would have sought help a lot sooner, but I personally experienced weight stigma from my GP, and it set me back years in being willing to ever have that conversation again.
Yeah.
So it definitely is. It is a barrier. If if you're a GP clinic that, you know, that's happy to be in this space, let us know.
Yeah. Yeah. And it's so much quicker getting treatment when it's not left till the very end of the line, when there is a lot of established, you know, for example, treating with metabolic and bariatric surgery, we can put diabetes into remission, particularly if we can treat within the first 5 years since diagnosis. So a lot of people come off their insulin or their oral agents if we can treat it within the first 5 years, but often because of that weight stigma and that reluctance to put yourself in a vulnerable position for fear of what might come, often people leave it till it's later and later and later, and there is worsening health conditions associated. And it's still very much treatable, and we can still get so much benefit at that point in time, but it's much easier getting referred earlier so we can help and kind of change the trajectory of life and health and happiness.
Absolutely. So Jarryd, when people are referred, and I know we've spoken about the timeframes and things, when would you encourage people to follow those referrals up? So at what point do you think that's reasonable?
I would say, so I know for myself, sometimes it takes a week or so for a referral to reach me as a triaging clinician. So I would say if you haven't heard within a month of that referral, I would certainly follow up.
Okay.
So certainly follow up at that point in time. And often it can be, you know, you just go through to whichever hospital is the main hospital switchboard, and follow up and just say you want to speak to someone about an outpatient referral and make sure that you're on the wait list for an outpatient appointment. And so using terms like outpatient appointment, outpatient waiting list, making sure your referral has been accepted by the team that you're referred to, those can help navigate that phone call as well, because often you'll speak to someone in the admin team. So knowing the clinic that you're being referred to and you know that you're waiting to see if the referral's been accepted, they'll be able to give you that information. And there's some hospitals in Victoria that offer metabolic bariatric surgery, and their outpatient wait list can be 5 to 8 years. It's, you know, and it's every hospital runs it very differently. So it just depends on which organisation you've been referred to and things. So there is some fabulous services available in Victoria. We're very, like I said, we're very lucky that we've got a lot of them in comparison to a lot of other states. But yeah, so just following up within that 30-day period, I would strongly advise. Yeah.
Okay.
And if you do have to travel, I've been told that there are some, or there may be available some subsidies and that.
Yeah.
So a certain distance.
So there is travel assistance schemes that are available. So on the government websites, even if you just search into Google, you know, Victorian, for example, if you're in Victoria, hospital travel assistance scheme, there'll be some things that pop up that can help support that. And there's forms that your treating doctors can fill out to be able to then help with that application. So there's that available. A lot of hospitals also have affiliated accommodation areas. So there is subsidised for people specifically coming in for, say, surgery, but they travel from Mildura to come down the day before. So there is subsidised accommodation. So that's available as well. And often it's those liaison nurses or the, you know, sort of care coordinators or navigators that have all those resources. But often it's on the hospital website as well. And it's just knowing, you know, on the Austin Health website, for example, you can search accommodation in the search bar and it comes up with a list of local accommodation, links to the website, distance they are from the hospital, if there's public transport and that kind of thing. So that's been really helpful for a lot of patients as well. So that's really handy.
That's a great point, Damo.
A lot of patients also don't realise that some appointments can be done telehealth as well. So we offer a hybrid. So some appointments we need to do physical assessments like listening to your heart and lungs, looking at neck movement or mouth opening, but others can be done where there's just that conversation that needs to occur in some education. So we do a mix of telehealth and face-to-face to kind of help lessen the burden of travel, because that can be a barrier for people too, you know, the finances associated with that. And so, yeah.
Yeah, no, that's excellent. And I think that the terminology and having the correct language and understanding what you've been referred to, knowing that it's an outpatient service or whatever, I think that that's a very, very important point.
Yeah.
To understand what it is exactly.
Yeah. And there's a lot of research around what's called health literacy. And so that term of health literacy is knowing that terminology and the lingo to know how to get to where you need to get to. And there's a lot of evidence that shows that those who don't have as high a health literacy have more barriers in getting or have trouble accessing healthcare because of those barriers. So healthcare shouldn't be for those that have only high health literacy, that have money, that live 15 minutes away from a metropolitan hospital. There's a number of things in healthcare should be accessible for all. There's something which I'm not sure if the listeners might be aware of, but there is something called the Australian Healthcare Charter of Rights. That is a list of things. There is rights and responsibilities when accessing public healthcare. There is a number of things on that list where you can actually, if you find you've got barriers that in accessing and say, actually, this is a right, this is part of the national guidelines of what should be provided in a public hospital. And so, and this is why I'm asking this, and this is what I need to be able to do that. So, and that's also, again, available. So just searching in Google, the Australian Healthcare Charter of Rights, that's a really just sort of a one-pager, few dot points and things, but it's quite comprehensive in what it covers. So people know what they deserve and what healthcare services are committing to delivering as well.
That's awesome.
Yeah. So if someone's having trouble accessing the help, what can they do? Is there, organisations that they can reach out to help them, or?
Yes. So there's a couple, so one advocacy group, which I really like to refer people to, and in our pre-surgery program, we advertise their service, is the Weight Issues Network. And so that's a group set up of advocates, not necessarily just focused on treatment for obesity, just people living in larger bodies or who have obesity that are wanting to have support. And so the advocates, and there is different state chapters in there as well, and there's different people that you can link up with to help get that support and guidance. And there is networks, there is some healthcare providers on there, but there is people with lived experience, which is, the majority of that, who can then help navigate that. And sometimes you just need someone to walk a bit of the journey with you to be able to get to the next step. And, I like to think of it as a bit of a relay. It's not, not that our patients are a baton by any means at all, but, we want to make sure that people have someone that steps behind them at each part of the journey to be able to help support, because it's, there's a real benefit that comes from that, and knowing that you're not alone.
Yep. Yeah. Agreed.
Yeah.
Agreed.
And that can be a real daunting thing if you're trying to do it alone, or, and you don't know the terminology and all that, and feel like you're not being heard.
Yeah.
It really helps to have someone that's sort of detached from it, but still cares enough that they're going to go into bat.
Yeah. And there's a lot of other services that people can access that may be specific to certain groups of patients. So I know, for example, at Austin Health, we have the Narrajara Aboriginal Health Service, and that's a group of people that are able to help advocate for those that are Aboriginal or Torres Strait Islander. That's some added support there. And we also have the disability liaison officers that are able to help support if people are living with a disability as well as obesity, and they can offer some additional support as well. So there's certainly other things within healthcare services, and a lot of those, again, are on the hospital websites. They really like to promote what they're doing in that. So if you're ever not sure what might be available in your local area, Google is a great place.
Yes. That's wonderful. Thank you.
There's also a lot of online shopping, which is a real problem for me, but...
Yeah, me too.
Yeah.
Problem for my daughter.
Yes.
We discovered the joys of some of the big online shops. And...
Yeah. Well, I think I got a notification saying there was a parcel delivered to my door while my husband's working at home today. So bless him, he'll give that surprise.
I love it.
Yeah.
Jarryd, thank you so much for joining us again.
Yeah, that was amazing.
You're very welcome. Very welcome.
Yeah.
Love to chat about this stuff. So
that was great. Thank you. We'll talk again.
Yes, very much. Look forward to sharing our new dietitian and our new psychologist, and just seeing how things grow. So
very excited.
Amazing.
Awesome.